Okay, so let's talk about toothbrushing. It's really daunting when you go into the supermarkets and the chemist to find this kind of thing. So many different shapes and sizes of toothbrushes, so many different makes. Which one do you go for? What I think we should do, let's think about how we can look after our own mouths. If I show you how to look after your own mouths, there's more chance of you then being able to look after somebody else's mouth. So first of all, I want to show you the difference with the sizes of the toothbrushes. Just get a few at random here. They do vary massively, the manual brushes in size. So I'm just going to pop those up to the camera. So you can see these ones are on the slightly larger side. Now my ideal toothbrush would be this one here, this sort of shape and size. This happens to be a teepee toothbrush, and you can just see that if you compare it, even with this one, which is a child's one, is actually a lot smaller. So I think for a lot of your residents, this one will be quite a useful brush. It's nice and soft, so you can get to the backs quite easily without sort of traumatizing them too much. So the first thing to bear in mind, we're going to sort of use the model to start with. In fact, what I will do is use, just to compare, I'll use my larger model. So I've got the bigger brush because of the larger teeth here. So we're going to start on the outsides at the top. And what you need to do is to be putting the brush half on the tooth, half on the gum, because it's this gum margin that we want to be cleaning, okay? And then it's more, if we're using a manual brush, it's more of a push and a scrub. Little scrub, mini scrub. When you get to the middle, you change your hand around. I won't, just for the benefit of the camera. So we go all the way around the outside. When we get to the outside, or when we get to the back, remember to try and go round the back if you can, and then start to come in that way and to brush the palate. So where the gum meets the tooth on the palate, all the way around. When you get to the middle, you can hold the brush up on its end, like that. And then again for the back, like that. When you've gone around the outside, you do the inside, and then you can just scrub the biting sides if you get the chance, okay? Same with the bottom. Now, so at the bottom, sometimes when we come to go on the inside, obviously we've got this little fella, this tongue in the way, and some of your patients will have a gag reflex. So if that's the case, just tilt their heads forward a little bit so that you can try and get in on the inside like that. It's not always easy, I know, but do the best you can. Again, when you get to the middle, hold the brush up on its end, and then again at the back where the gum meets the tooth on the inside. So we've gone around the outsides, hopefully first, insides, and then the biting sides. So that's really basic toothbrushing. Now, obviously that's the manual brushing. The electric brushes are really good, really useful. So there's a couple of different ones I've got here. This one's a Braun Oral-B toothbrush. The nice thing about this one is that it lights up. So this one, if you press too hard, it'll go red. If you're not pressing hard enough, it'll go blue. So the optimum is green. And this is a very different action. So when we're cleaning with an electric brush, we want to just be holding it still. So holding it the same so that you're covering that gum margin there, but you're just wanting to hold the brush still and just move it slowly around the mouth. If your residents have been used to using a manual electric toothbrush, then they will be familiar with this. Okay, try not to get them to scrub. Try and get them just to use, as say, one tooth at a time. Same principle, all the way around the outside and all the way around the inside, and then the biting surfaces ideally as well. So that was the Braun one. There is a Sonicare version as well. What I would urge you to be careful of and be aware of are the different sized heads again. So I'm just going to pop those there. This is actually my one. This is a Sonicare. It doesn't really matter which one you use. They both have a slightly different action. So again, as you can see, this head is quite a bit bigger than this head. Now, I will personally use them all, but my preference would be to use the little head there. So what I'm going to do, I'm just going to show you in my own mouth what to do. So with the Sonicare, it's what they call a slide and glide approach. So putting it actually in the mouth, on the teeth, like so, and you just slide it along like that, around there. So it's a slightly different action to the round one. Round one's probably the one that most people feel more comfortable with, okay? So, but either one is absolutely fine. And as I say, healthy gums shouldn't bleed. So if you notice, I haven't got any bleeding there because I do kind of try and get to the gums as well. If your patients are used to flossing or using little brushes, toothpicks in between their teeth, it's a really good idea to encourage that to continue. So floss, you may have all seen floss before, you may not. Floss comes like this. This one I quite like. This is actually a tape, it's slightly thicker. Easiest way to do that is to wrap it around your middle fingers, and then you've got a nice firm grip on your finger and thumb. You put it up, and then you wrap it around like so, wrap it around the other side, and then bring it out. Up, wrap it around, bring it down. Again, wrap it around, bring it down. And again, there should be no bleeding with that, okay? For ease, these little things are quite useful. They're sort of ready to go rather than sort of worrying about flossing around your fingers. And the same sort of principle, some people get on quite well with either of those kind of things as well. And just for comparison, there's water flossers that are now available as well. These can be quite useful for your more able-bodied residents. Best way to do this is in the shower, because when it's full up with water, there's a little chamber here, you fill with water, and they can create quite a bit of mess. I'm not going to actually switch it on, but the idea is that you have these little water flossers, and rather than using your floss, you walk it around each tooth like that, and it blasts air and water at the same time, quite a large sort of jet of water. If you're standing in front of the mirror, you will get a bit of a shower, but as I say, if you can actually stand in the shower or get them to sit in the shower and use it all around their mouths, then that's good. And the nice thing about this one, you can put nice warm water in it, use it on the outsides and the inside. This one just happens to be one with a cord, but nowadays you can get them cordless and they're much easier and much more user-friendly. So that's water flossers, and they've definitely got their uses. Especially for patients that have got a lot of crowns or implants. You may come across implants. So things that are a little bit more technical in the mouth that need a little bit more specialist care, those are really useful. And then the last thing I want to show you are the interdental brushes. So you can get various different shapes or sizes. They're like little toothpicks, but they're more sort of a brush kind of thing. This is a different make. This just happens to be one that I use. This is quite a small one because my gaps are quite small. And you just literally put them in between the teeth like that, and in and out. In and out is sort of a massaging action. And so again, they can be used all around the mouth. Okay, so important to clean not just the teeth, but the gums as well. All right, and just the last thing I will show you is the 360 brush that we've discussed. So this is really useful for sort of, end of life care, palliative care, because it's a nice little small round brush. You can just literally rotate it and remove any debris that's up around the mouth, around the cheeks, and certainly around the tongue as well. It's a good idea to give the tongue a bit of a clean. We all build up a bit of bacteria on the tongue, so it all helps to reduce the amount of bacteria in the mouth.